Welcome back to our channel. Today we are exploring MASLD and MASH, two of the most common yet overlooked liver diseases worldwide. Nearly 1 in 4 adults is affected by fatty liver disease, and most people have no symptoms until serious liver damage develops. If left untreated, it can progress to cirrhosis, liver failure, or even liver cancer. In this video, we will cover the causes, risk factors, diagnosis, treatment, and the latest 2024 advances, including the new therapies that are changing the management of MASH. Let's begin by understanding why fatty liver is known as the silent menace. Let's begin with a real life case. Meet Mr. Rajesh Agrawal, a 45-year-old IT manager who feels completely healthy and has no symptoms. During a routine health checkup, his blood tests show elevated liver enzymes, diabetes, high triglycerides, and an ultrasound reveals grade 2 fatty liver. His FIB-4 score is 1.58, placing him in the intermediate risk category. So, what should be the next step? So, the correct answer is FibroScan along with aggressive lifestyle modification to assess the liver's fibrosis and prevent disease progression before the complications develop. One of the biggest mistakes in the liver disease is assuming that no symptoms mean no disease. MASLD often remains silent until the significant liver damage has already occurred. Another common error is relying only on normal liver function tests. Patient can still have advanced fibrosis despite normal ALT and AST levels. Never label the fatty liver as harmless without proper staging, and avoid prescribing the medications like UDCA or Silymarin without clear evidence. Instead, follow the 5-step golden rule. Screen at risk patients with ultrasound and liver function test. Calculate the FIB-4 score. Stage with FibroScan if the risk is intermediate. Confirm with biopsy only when necessary. And finally, treat with lifestyle modification and evidence based therapies. MASLD is not caused by a single factor, it is caused by multiple processes that work together to damage the liver. It starts with the insulin resistance, which increases the fat accumulation in the liver cells. This is followed by oxidative stress causing liver injury. Gut dysbiosis promotes inflammation, while genetic factors increase the susceptibility in some individuals. Over time, stellate cell activation leads to fibrosis, and persistent injury may result in genomic instability, increasing the risk of the liver cancer. Understanding this multiple hits explains why clearly early intervention with lifestyle changes is so important. MASLD progresses through several stages if left untreated. It begins with simple steatosis, where fat accumulates in the liver and the condition is still fully reversible. As inflammation develops, it progresses to MASH, followed by the fibrosis, where scar tissue begins to form. Once the patient reaches the advanced fibrosis and cirrhosis, liver damage becomes difficult to reverse and the risk of hepatocellular carcinoma or liver cancer rises significantly. So, early detection and treatment can stop the disease progression before reaching the point of no return. Diagnosing MASLD requires the right combination of blood test, imaging, and in selected cases, liver biopsy. Start with the blood test, including the AST to ALT ratio and the FIB score to estimate the fibrosis risk. Next, use the ultrasound to detect fatty liver, while FibroScan helps stage liver fibrosis non-invasively. MRI can provide the most accurate assessment of liver fat when needed. Liver biopsy remains the gold standard, but because it is invasive, it is reserved for uncertain cases or when confirming advanced disease before specific treatments. As MASLD progresses, it can lead to three major life threatening outcomes. The first and the most common is the cardiovascular disease, which remains the leading cause of death in these patients. The second is the liver failure caused by advanced cirrhosis, leading to complications such as portal hypertension, variceal bleeding, and ascites. The third is the hepatocellular carcinoma or liver cancer, which requires regular surveillance in high risk patients. Remember, MASLD is closely linked with diabetes, chronic kidney disease, CKD, and obesity. So, managing these conditions is just as important as treating the liver itself. Some patients with MASLD require urgent referral to the hepatologist. Watch for these important red flags. A FIB score about 2.67 suggests advanced fibrosis and needs specialist evaluation. An AST to ALT ratio greater than 2 may indicate advanced liver disease or an alternative diagnosis. A platelet count below 1,50,000 raises suspicion for portal hypertension. Finally, signs of decompensated liver disease such as ascites, jaundice, or hepatic encephalopathy indicate advanced cirrhosis and require immediate specialist care. Recognizing these warning signs early can significantly improve the patient outcomes. Pillar 1 and 2 established treatments. Treatment of MASLD starts with a lifestyle modification. A 7 to 10% weight loss can reduce fat liver and even reverse the fibrosis. A Mediterranean diet, regular exercise, avoiding alcohol, and moderate coffee intake all support the liver health. For selected patients, medications may help. Pioglitazone and vitamin E have proven benefits in specific cases, while GLP-1 receptors agonists are promising, especially in patients with obesity or diabetes. One important exam point: metformin improves the diabetes but does not directly treat the MASH, so it should not be used as liver specific therapy alone. Pillar 3, the 2024 breakthrough. One of the biggest advances in liver medicine is Resmetirom, the first FDA approved drug for MASH, approved in March 2024. It works by activating the thyroid hormone receptor beta, reducing the liver fat and improving the liver inflammation and fibrosis. It is indicated for biopsy confirmed MASH with F2 and F3 fibrosis but not for cirrhosis. A key exam point: obeticholic acid was not approved, making resmetirom the current breakthrough therapy. MASLD versus ALD. For exams, remember these key differences between both. In MASLD, the AST to ALT ratio is usually less than 1, while in ALD it is greater than 2. GGT, MCV, and ferritin are often much higher in the alcoholic liver disease. The easiest way to remember is AST greater than the ALT suggests alcohol, whereas ALT greater than the AST favors MASLD. This comparison is high yield point for exams. Let's solve this exam case. The biopsy shows steatosis score 2, inflammation score 2, and ballooning score 1. Adding them all together has a NAS score of 5. A NAS score of 5 or more confirms the MASH. Since this patient also has F2 fibrosis, they are eligible for resmetirom, the FDA-approved treatment for MASH. Remember, steatosis, inflammation, ballooning is equal to the NAS score. This is a favorite exam question. An important concept in India is the lean MASLD. Around 10 to 25% of the patients develop fatty liver despite having a normal BMI due to genetic factors and metabolic risk. The PNPLA3 gene variant, along with diets rich in refined carbohydrates and saturated fats, increases the risk of liver fat accumulation. Although resmetirom, a major breakthrough, its availability and cost remain challenges in India. For now, lifestyle modification, pioglitazone, and vitamin E remain the most practical treatment options for eligible patients. Remember these three key takeaways: fat hides, fibrosis scars, and early detection saves life. Screen high risk patients, calculate the FIB-4 score, stage the disease properly and appropriately, and start the evidence based treatment before irreversible damage occurs. Thank you for watching this video. I hope this session has helped you understand the MASLD and MASH in a simple, practical, and exam focused way. Remember these key points: fat heights, fibrosis scars, and early diagnosis save life. If you found this video helpful and useful, please like, share, and subscribe our channel for more high yield medical content. Also, let me know in comments which topic you would like to learn next. Until then, keep learning, keep growing, and stay healthy. This is Anjali signing off. Medicine that sticks. See you in the next video.